Political Capital is brought to you by Uber Canada, building a better future for those who connect our communities.
CHEK Podcasts.
Hey everyone, and welcome to Political Capital, your source for all the latest in BC politics. I'm your host, Rob Shaw, coming to you from the CHEK News World Headquarters here in Victoria. Our show in its many forms on CHEK, YouTube, audio podcast, brought to you free as always by our sponsor, Uber Canada. Thanks to Uber for supporting us. A busy week in BC politics. Ottawa bails out BC on bail reform. BC starts shipping people to the United States for cancer care, plus some other topics. Let's bring in the pod squad to explain it all to us. Jillian, Jeff, and Allie are here as always. Thank you to you for your insight and expertise. Let's start with bail reform. We've been talking about this for months now. The frustration over prolific offenders, small number of folks in and out of the justice system charged, committing thefts and assaults and crimes again and again, back out on the street. BC wanted Ottawa to change the bail rules. Ottawa delivered a new legislation this week that responded and made those changes. It hasn't passed yet, but we can talk about that. Let's go around. Is this what BC wanted? Is it going to make a difference? Is it a win for the Eby government and what it was looking for here? Jeff, why don't you start us off?
This is exactly what David Eby wanted. The Premier's advocacy worked. Government of Canada is taking action and strengthening the bail system. It's real action, more than just sound bites, angry sound bites, which is the level of debate we've been seeing on this issue for an awful long time. And specifically what it does is it creates a reverse onus for individuals involved in repeat violent offenses with weapons. So before, they had the onus was on prosecutors to prove that folks didn't deserve bail, and now the onus is on the accused to prove that they do deserve bail. And it emphasizes accused history of violence, use of weapons, intimate partner violence, previous convictions. It's common sense. It's smart. It's something that's going to actually make a difference. It's a win for David Eby for certain, but more so a win for British Columbians who are wanting to see action on this public safety issue, which is on the minds of so many for many good reasons.
Mm-hmm. We talked in a previous episode about how the government's own stats showed that, you know, when prosecutors asked for someone to be held in custody on a violent repeat offender to be held in custody waiting for trial, in half the cases the judge did not allow that. And this is supposed to address the kind of rules that the judges will look at when they're deciding bail, the factors they have to consider. In fact, one of the changes in here is judges have to state on the record that they have thought of community safety and public safety in choosing whether or not to grant someone bail in cases, which will be interesting to watch in reality. Allie, what do you think? Win for the Eby government, a good bill, or I know there's some debate, federally at least, that it kind of falls a bit short.
It is a win for the province, but this was also a win for the country. So the start of all of this was a letter that David Eby signed, but alongside other provinces as well. So I think the weight of that, the fact that no matter what your partisan lines were across the country, everyone was able to sign this letter and ask for the federal government for support, really got it across the finish line. The Canadian Police Association put out a response to the bail reform announcement, and it had 3 sections of it. And I think this is important to note, because what they've been asking for from the National Association is tougher on crime. So this definitely fixes that, or is heading in the right direction. Rehabilitation and prevention. So if we've now marked one, we still have to focus on the other 2, which I think is the other part of this conversation. We really can't have tougher bail reform and stricter laws if we're not also dealing with the preventative side of things.
Mm-hmm. There's also a capacity issue too. And I remember the prosecutors saying that if they asked for people to be held in custody, all the violent repeat offenders all the time, the system would just collapse. We don't have the capacity to handle that. We don't have the staff or the jail resources. So I'm not sure what the impact of this is going to be if it is even successful in doing what we want. Jillian, what do you make of the bill and how it might play here in BC?
Yeah, I agree largely with what Jeff and Allie said. I think this shows that Ottawa is listening to the provinces. BC is not the only province to be experiencing feelings of, worsening public safety in the last couple of years. It's a huge issue in Ontario as well. So it's not surprising that the federal government moved to act, given how much noise there's been about this issue. I think there's a bit of a fight brewing in Ottawa about it, the Conservatives saying that it's not enough, but it seems like the bill goes as far as it can without really running the risk of getting thrown out on a constitutional challenge. And even so, it might run up against some of those challenges in court. So that'll be interesting to watch to see if the government has struck a right balance there. We previously went through this with Conservative reforms under Stephen Harper that were thrown out. So that's always an issue. Does it fit within the Charter of Rights and Freedoms, which say that you can't hold people, unduly until they're found guilty? So that'll be interesting to watch. I think, it's really hard to craft laws that are going to be broad enough that they fit every case. Some of the high profile cases that we've seen in BC were not from prolific offenders. So, to Allie's point, the government now needs to move to addressing the root causes of crime, prevention, and looking at how it can improve public safety in a more systemic way.
Jillian, staying with you, do you think it reduces the political pressure on the Eby government? We saw the premier go to Nanaimo and he got hit by protesters. We're seeing cafes, talk about all the vandalism by the same person again and again. That sort of pressure that filters up through municipalities, through the opposition, through mayors to the province to act, even on an issue that some of it is outside of their control. Does this lessen that pressure politically a little bit, or how do you think it plays?
I definitely think it lets a little bit of steam off the issue, shows the Eby government, gives them something they can point to that, they've been effective in securing from the federal government. And for, it sounds a lot better than saying, we need the federal government to act, it's out of our hands. Now they've actually got something they can point to. But I don't think it alleviates it completely. It's, like I said, I think there's more for them to do, and this isn't going to solve people's fears about public safety overnight. So I think it's an issue they're going to continue to work on, but it's a little bit less intense than it was, a week ago.
Yeah. Jeff, what do you think? How does it change the political dynamic? And it's not just the opposition, but it's, mayors and it's police departments and it's business owners and it's downtown cores saying we see the same people again and again. Does this show them some type of progress? Does it take the pressure off of the Eby government, or is it still there in a larger issue?
Well, we'll have to see how it rolls out and how it plays out in the criminal justice system. The hope, and the obvious hope, is that this stabilizes the law enforcement criminal justice system element of how do we make our communities safe. And that, you would hope, creates room to address the things that Allie pointed out to. And I did a little fist pump, when she talked about, there's the preventative side of community safety, and that's important. And that means different things for different folks. But for me, some of the pieces of the puzzle on that side are massive income inequality, differences in between the haves and the have-nots. The greater the disparity, the greater the feelings of marginalization, frustration, and desperation that can lead to criminal behavior. We live in an age of hyper-fractiousness, when people feeling sense of alienation and mistrust of society and fellow citizens, more likely to engage in violence against others. That's happening everywhere. And trauma. We have a massive trauma problem in Canada. 20% of people report physical abuse as kids, 10% sexual abuse, all kinds of youth in care, Indigenous nations dealing with the lingering effects of residential schools and the trauma being yanked away from their families and everything that's come of that. And that's why you see so much representation on their side in the criminal justice system. So, and then that leads to coping mechanisms like self-harm and drug abuse, which we've talked about a lot on this show as well. So what I what I hope is it brings stability on the criminal justice side, and it lets us focus on those big underlying issues which are driving so much of the rise in crime here in BC and all across North America.
Mm-hmm. Allie, what do you think the opposition, BC United, does with this? They have spent a lot of time talking about David Eby's catch and release system, the revolving door, as they call it. There's a big political emphasis that the party has put on that public safety issue. What do you think they do in the wake of legislation like this?
One, I'm hoping that they see this as a gift from the federal government. So like, this is something that helps us across the province no matter what, and it was everyone's win. It wasn't a partisan win, like I said earlier before. Now I think the federal government's done their job, so now the province has to figure out what they do. And a lot of this now is trying to see if we have the resources to actually prosecute people. So what was it, last year or earlier this year, the NDP made an announcement that they were going to create these hubs for the backlog and to prosecute people faster. Because if we're saying bail versus jail, then we want to make sure that they're getting their fair process in a timely manner so that the justice system actually works the way it's supposed to. So all they can do right now is hold the NDP accountable for that, and for any other announcements that they make on creating safer communities across the province.
Mm-hmm. It feels like it's still on the table for the opposition to use as a wedge issue, because we have the public drug use issue that's going on. We have the mental health and addictions crisis. We have the debate over involuntary care. Those issues may or may not, be impacted by the reverse onus on violent repeat offenders and bail. So I think that it feels like there's still room for this to become, a political hot potato or headache for the Eby government, depending on how those resources roll out. So I don't think it's the end of us talking about public safety as a political issue. Let's move on to another story this week. Kind of came out of nowhere from the health minister, Adrian Dix, announcing that due to unacceptably long wait times for cancer radiation treatment, the government will begin paying for people to get their breast and prostate cancer radiation treatment at private clinics south of the border in Bellingham. As many as 50 people a week. They'll get their travel and hotel and meals paid for as they undergo 5 days of radiation treatment at almost triple the cost. Would it be done here in British Columbia? Lots of discussions about this, particularly the idea that an NDP government, which is shutting down private facilities in BC, is contracting out services to the American system, which a lot of Canadians kind of look down their nose at. Everyone's talking about this. How do we sort of unpack it a little bit? Allie, let's stay with you on that one.
The best way I could describe this is that this is a group project that one side has been doing all of the work and the other hasn't. Let me explain that. The NDP asked for more resources when it came to the health budget. I mean, every province was, but they went to Ottawa and they asked for more money and they didn't get it. So as much as it pains me to say this isn't necessarily the NDP's fault, because what are they going to do with the limited amount of resources that they have available to them in the budget? And they went and asked the federal government for it and they didn't give it to them. So who's to blame here is actually the federal government. We're doing the best that we can with the resources that we have in the middle of 3 massive crises that require a lot of resources, and we've said it over and over and over again, it's affordability, safety, and health. And we can only do but so much. And so we're doing the best that we can here. And we asked for that lifeline for federal government funding and we didn't get it. Now, not to say that we shouldn't be holding the NDP accountable to this, because there are some solutions put forward by BC United even this week, like the ridiculousness that we're putting and sending people to the States when people in the Kootenays could easily go to the closer jurisdiction of Alberta to get cancer treatment and be a little bit better for them. I mean, at the end of the day, what we want to make sure is that people are getting the care faster, and we're not really doing that.
Mm-hmm. It is a big question in the Kootenays, but from my understanding is the Alberta government told us no, that they didn't have capacity. They're dealing with the same staff shortages and issues that under-resourcing the British Columbia is. But it would make a lot more sense, depending on where you live, to go there than Washington State. Jillian, what do you think of this? It feels, like both a bold idea in a way for a government like this, but also kind of an indictment of our system, all in one.
Yeah, that's a good summary. So this comes on the heels of a Globe and Mail report that showed that cancer patients in BC, after they get a diagnosis, are waiting longer than the recommended amount of time before they get radiation treatment. I think when the health minister had that information become public, put a lot of pressure on him and knew that he had to act. Cancer, eventually will touch all of our lives. And so I think that people really understand how terrifying it is to get that diagnosis and then to have to wait weeks, even months for treatment. It's really, really scary. And I think that the health minister did the right thing to make sure that people are getting treatment by any means necessary. I think this, though, and the opposition has raised this a lot this week, does point to a huge systemic issue. One, why did we have to wait for a leaked data to get this movement many months later after that came out? And why, with the government knowing, and this is on both of the major parties, on United and on the BC NDP, knowing that we have an aging population that's going to be experiencing more cancer as our population gets older, why did we not make the necessary investments to make sure this didn't happen? We used to have one of the best cancer agencies in the country, and it's come to this now after warnings from BC Cancer for the last decade that we were going to be running into problems. One of the issues, staffing, we're all, pretty well versed on how difficult it is to staff up the hospitals right now. But one of the issues is equipment, is the radiation machines that are required. So why hasn't that procurement been happening when we knew that we were going to have greater need down the road? I think those are really important questions to be asking.
Mm-hmm. The NDP did just announce a 10-year cancer plan to address some of those, but you're right. It's like where has that planning been for the better part of 2 decades now? I guess. Jeff, what do you make of this?
Well, it was sidelined by the fact that we had a global pandemic that dominated everything for an awful long time. And I'm glad to see that the government has moved forward with its cancer plan. Look, no one wants to go to Washington for cancer treatment. No one wants to pay 3 times more than what you get in the public system here in BC to provide the same level of service at a private clinic. In the United States, the only thing worse than that is that having to wait too long for cancer treatment when you're diagnosed with breast or prostate cancer. And so what the minister is doing here is fixing that. And he's not doing it because he saw it in a newspaper. I think anyone who knows BC's Minister of Health, Adrian Dix, knows that that what moves him are what he sees in the health system and the numbers in front of him and the challenges ahead. And this would have taken months to pull together. And it would have started the moment that he saw numbers that showed that the system was headed in the wrong direction. And so I give him kudos for doing this, for taking the political hit that he's taking on this, and call it an indictment. I see it as a sign that the government and certainly the health minister are focused on people and what matters to people. And I'm glad that the health minister was able to put aside those kind of ideological arguments around public versus private and cost, and focused in on the people who are diagnosed with cancer and facing those long waits and saying, I got to do what's right for you. And I think that's what the government did in this case.
Jeff, do you think it would have been a tough sell at cabinet? Like, I'm just trying to imagine, Adrian Dix telling people amidst fights with, private healthcare providers that we're going to contract out to Washington State. I imagine ideologically he must have had to overcome some hesitation from colleagues and probably the base.
I'm sure he did. I'm sure he did himself. And you would think of how the government is repatriating workers who were contracted out under the former BC Liberal government They brought in 4,600 workers into the public system from the private system after they got fired in a mass firing, and saw their wages and pensions and benefits slashed. But that was about people. That was about helping those people. And you can also think of times where the health minister and the government have leaned into the private side of healthcare, quite frankly. And you need to look no further than the deal with doctors, where they gave family doctors, or private enterprise in the province, raises of $120,000 a year, and didn't blink an eye. And they did that because it's what people making $50,000 a year wanted, which was to make sure that healthcare was there when they needed it, where they needed it. And you can have the debate societies where you talk about the ideology behind all of this, but at the end of the day, you got to focus on what's right and best for people in the moment. And that's what the government, I think, has done.
Yeah. Jillian, do you think that there's any Pandora's box that's been opened here on cancer care? Because I know that if you live in the rural or remote parts of this province, I was talking to a woman who had breast cancer in Cranbrook, had to drive 7 hours to Kelowna, in the winter, put herself up in a hotel. There's a few aid programs here and there, spent thousands of dollars. She would have loved to have had her expenses paid in a flight to Bellingham from the government. There is a part of the cancer system for people outside of, urban areas where you're on the hook yourself to pay for a lot of expenses. Now government's offering to pay it, in this emergency situation for people. Is that do you think that will rankle anyone outside of the urban areas?
Yeah, I mean, living in one of those kind of communities myself, people are kind of used to it. You kind of just know that if something really serious happens, you're going to go to Kelowna. I know a number of people who've been helicoptered to Kelowna for all kinds of different things. It's pretty kind of normalized here, I would say. But I do think that, giving people a sense that it is possible to do it another way does open the door to that. We actually saw a lot of hospital consolidation in the 90s under the Liberals. We used to have an ICU here at our hospital in Nelson that doesn't exist anymore. And that issue came up during COVID because a person died that had COVID while they were trying to get to a respirator in Trail. So people start to ask, if we have the physical space and we have a hospital here, why can't we have some more of that localized capacity? I think that's a really important question to be asking, and for the government to be looking at, especially as we experience more extreme weather. It gets harder to have those emergency helicopter flights to take an ambulance far away. It's something that the government could look at for sure, especially where we have existing infrastructure in places like Nelson.
Great. Out of time. Thank you to the panel for being here. Political Capital is brought to you by Uber Canada, building a better future for those who connect our communities.